We're here to talk about the Republicans' new push to repeal this law. Democratic strategist James Carville and Republican strategist Kevin Madden. Gentlemen, thanks for joining us. James, let's start with you. This has never been done, making people buy something just to exist in America. If this ends up in the Supreme Court, the Democrats get nervous.
They might. Look, if the Supreme Court, obviously, if they think it helps the Republican cause, they'll rule that way. I'm nervous about it, but you know, I'm not sure that they're going to conclude that this is in the Republicans' interest to turn this thing down. It'd be pretty much of a hue and cry around the country. This thing's already turned popular right after it passed, and I think as it goes on and on, it'll increase in popularity, and the Supreme Court will look at that and might conclude that it's not in the Republicans' best interest for them to overturn it.
Kevin, it's already federal law that emergency rooms have to take all comers, and Republicans have been pushing for mandates, your old boss Mitt Romney included. So what about this argument now?
Well, look, I think you remember the mandate issue was one that was advanced by Republicans years ago because it was a counter to the Democrat effort to have employer mandates. So, but I do think we have to remember that there is a difference between trying to compel an individual in a state from the federal government getting that mandate to buy something that is a private industry. So they're going to force individuals to go out and buy plans from private industry. So I think that's where a lot of these attorney generals feel that they have legal standing to sue.
Yeah. Aside from the lawsuits, Republicans still in the Senate, James, can try to gum this up with amendments that House Democrats will cringe over, including Tom Coburn. He wants to add one that would prevent sex offenders from getting Viagra prescriptions, which you can already see the political ad if a Democrat votes against that. Well, could this unhinge this still before it even gets out of the Senate?
Well, no, I don't know if it'll unhinge it. Look, the House Republicans are trying to change the Constitution to do away with popular elections of United States senators. I mean, there are people out there going to be doing all kinds of things here. But I think, by and large, that you know, the president signed this into law. There are going to be amendments. The Senate Republicans are already blaming the parliamentarian who was appointed by Senator Lott. You know, this is what they do. I mean, you look at the behavior around leading up to this and the behavior after, and it's been pretty consistently horrific.
Here's the new poll that James referenced, Kevin. The new USA Today Gallup poll, 50%, or just under, 49% say passing this bill is a good thing. 40% call it a bad thing. Those who are opposed to it, though, are very angry. Will that be enough? Will there be enough steam left in that anger come November? How many House seats do you think Democrats will lose as a result of this?
Well, look, I think this is that poll right there is a snapshot, I think, of the last 6 days. And there's nothing that makes a party or a president look like winners than a win. So they've got a legislative win right now. But this is where the tough part starts, trying to sell this thing politically. I would disagree with James that this bill has become popular overnight with the stroke of a pen. We watched a debate progress for a year, and the bill became more and more unpopular because of the partisan process in Washington and because of the price tag. So I think that Democrats are going to have a very hard time in November going out there and explaining to the American people that they think that it was a good idea to spend over $1 trillion at a time where we don't have that kind of money, and that we ought to have a federalized mandate, a federal standard out of Washington on health care, when states are probably the best laboratories of democracy to help get care and drive down costs for unique health care populations across the country.
Well, James, how does the president pivot to other issues on his agenda when he still has to sell the health care bill?
Well, you know what? It's a big job. He's got a big airplane. He's got a big house. He's got a big staff, and he's got to be able to do two things at one time. Sometimes you got to do 5 things at one time. And look, you know, he's going to be a busy guy here at this bank. You know, Republicans are lined up. They're trying to do everything they can to protect Wall Street here. They're very inclined and very favorable toward what's happened on Wall Street. Democrats have a different view, and this is going to be another big battle here, and they're going to have to gear up for this one because this is a big deal.
And finally, I have to ask you, gentlemen, you're both students of history. Is there any truth to the story that when LBJ signed Medicare, Bess Truman whispered, "This is a big effing deal"? Your impressions on the vice president.
James and I both have a propensity for profanity, so don't put me in the position. Don't put me in the position of having to defend the vice president here.
Very smart, Kevin. You never know what's going to come out of somebody's mouth, mine included. And but he can say some things. I'll say that about the vice president. But that's a very smart thing to say, Kevin. It really is.
Let he without the salty tongue cast the first stone, right? All right.
Exactly.
Kevin Madden, James Carville, we appreciate your time.
Great to be with you.